What's up, PA world? How's it going, guys? My name is Mesha and welcome back to my channel. In today's video, I want to walk you through my 100 fast and equal questions for your PANCE exam prep. These questions, guys, were the ones that I studied when I was preparing to take my PANCE exam. For those of you that have already subscribed to my channel, thank you very much. And for those of you that haven't, go ahead and please subscribe and help me grow this channel. Alright guys, first thing first, all I want to say is congrats, you made it through the PA school. Now you just gotta prep for a PANCE and get that big C, baby. In my experience, the EORs and RASH, they all follow the same testing strategy, and this is important because I noticed that they all follow that same long stem, and they give you that last sentence in which they ask you a question, what's the most common, and so forth. So while preparing for a PANCE and studying from different resources that I talked about in my PANCE prep video, all along while I was studying, I would create my fast and equal questions and study those in order to recall information faster, since the test is longer and these kind of questions help me memorize and do better in my EORs and my PACRAT. In my PANCE prep book, you will find over 3,000 questions like what's most common, next best steps, side effects of meds, signs, triads, syndromes, best treatments, x-ray findings, risk of development of different diseases, and so forth. That's what worked for me, and that's what I studied when I was preparing for exams. So check out this video, check out the slideshow, and if that helps you, even better. If not, then just stick to what works for you. Take care, guys, and once again, best of luck. And here we go with the 100 PANCE prep questions. Good luck. Alright guys, so before we dive into those 100 fast and equal questions for your PANCE or PANRE, first of all, I'd like to walk you through my test taking strategies for test exams. First thing I do is I read the last sentence first. By reading the last sentence first, I'm not triggered by stem. I don't care how long it is, how short it is. Usually by reading the last sentence first, skimming over the examples, I'll have my answer within a couple sentences usually. So by reading the last sentence first, I'm looking for what is it that they're asking me in this question. So which of the following organisms is the most common cause of pneumonia in this patient? So they're looking for most common cause of pneumonia in this patient, which organism? So I look at answers: Chlamydia, Klebsiella, Mycoplasma, Streptococcus. I know each one of these presents the different patient population. So with that in mind, I start reading the question and seeing if there's something in the stem that would tip me towards one of the answers. An elderly man was brought to the ER by EMS in acute respiratory distress, acute onset of fever, altered mental status, left pleuritic chest pain, and cough that is productive. So this could be anything. EMS states that a patient was picked up in a park, found next to a couple of empty bottles of hard liquor. Right there, I have my answer. So this tells me this patient is an alcoholic, and I know the most common cause of pneumonia in alcoholics is Klebsiella. With that, I can just stop reading the question, I can select my answer and move on if I'm pressed for time. So I hope that helps you. Try it out with RASH, try it out with different platforms that you're using, and see if that's something that works for you. I hope it does, because it really helped me. Do these 100 fast or equal question. So the first one is a busy slide, but I think this is one of those questions that you'll more than likely encounter during the PANCE or PANRE, and it's how to understand hepatitis B. They're going to give you a stem talking about a patient was tested, and these are the results. So understanding Hep B and HB sag, etc. So like I said, it's a busy slide, but once you understand this, you'll never get this question wrong. First thing I look for, is there an HB sag? If the question mentions HB sag positive, I know right there that this is either acute or chronic Hep B. The next is, I look, is it IgM, which is acute, or IgG chronic? So if it's IgM and HB sag, it's acute. And if HB sag and IgG, that is chronic. If they don't mention HB sag, but they mention anti-HBs and IgG, that is recovery. And finally, if it's only anti-HBs without IgG or anything else, that is immunity. So once again, so you can see how I broke that down, and I hope you understand it now and get that question right. Second, most common diagnosis by endoscopy: functional dyspepsia. Most common cause of peptic ulcer disease: H. pylori. The most common cause of mitral stenosis, rheumatic heart disease. Most common cause of acute pancreatitis, alcohol and biliary disease. 4 patient groups that will benefit from statins. 1. Clinical ASCVD. 2. LDL greater than 190. 3. Diabetes patients with LDL from 70 to 189. And 4. LDL from 70 to 189 and 10-year ASCVD risk score greater than 7.5. Aortic stenosis presentation triad. ASH, angina, syncope, and heart failure. One of the things that really helped me when I was studying is to make mnemonics, funny stories, or just put in a story, give it a different name. So like in this case, aortic stenosis presentation, I just think ASH, angina, syncope, heart failure. Most common dysrhythmia, A.Fib. The most common cause of A.Fib, coronary artery disease and hypertension. The most common cause of death in a physical abuse, head injury. The most common cause of travelers' diarrhea, E. coli. The most commonly used study to diagnose left atria thrombi, echo. So I remember this as I listened to the left atria and I heard an echo. So if anything mentions left atria and a test, I just think, oh, left atria, I heard an echo, so I pick an echo. The most common cause of vitamin B1 deficiency, alcoholism. The most common organism that causes malaria, Plasmodium falciparum. And I think malaria, I think fake plasma bug. So every time I think of malaria, I think of fake plasma bug. Fake for falciparum and plasma for plasmodium. Fake plasma bug. A most common preventable cause of death, smoking. Most common pituitary microadenoma, prolactinoma. Most are non-functional. Most common tumor causing SIADH, small cell lung tumor. Most common cause of hyperthyroidism, Graves' disease, hypergrave and hypo-Hashimoto. Hyper for hyperthyroidism, and for hypothyroidism, most common causes Hashimoto's. Most common thyroid cancer, papillary. Most popular, papillary, PP. Most common fracture in Paget's disease, vertebral crush fracture. Most common cause of Cushing's syndrome, exogenous glucocorticoid use. Most common complication from diabetes mellitus, neuropathy. Most common virus causing common cold, rhinovirus. Rhino commonly gets a cold. Most common bug in bacterial sinusitis, strep pneumo. Most common cause of B12 deficiency, pernicious anemia. Most common population affected with the B12 deficiency, vegans. Any question with a vegan patient in it, you should be thinking about B12 deficiency. Patients with the B12 deficiency are at increased risk for what? They're at increased risk for gastric cancer. Most common race affected by Thalassemia A, Asians. A in thalassemia stands for Asians. Most common race affected by Thalassemia B, Mediterraneans. I just think Europeans, Middle Easterns. Most common cause of death in the sickle cell patients, pulmonary issue. I hope you guys like these kind of questions. I hope this video is really helpful to you. I would truly appreciate it if you subscribe to the channel, help me grow it, help me make more videos, and thank you for watching so far. And here we go. Most common type of headache, tension headache. What scoring system is used for acute pancreatitis? Ranson's criteria. In patients presenting with epigastric abdominal pain, you should always consider what? Always consider pancreatitis and odor lipase. Most common initial symptom of the sickle cell, dactylitis. Most common bleeding sites for hemophilia A and B. These will be the joints, likely ankle or knee. Sickle cell is diagnosed by hemoglobin electrophoresis. Most common cause of croup, parainfluenza virus. Semster triad is aspirin sensitivity, nasal polyposis, and asthma. Drug of choice for pertussis, macrolides, azithromycin. Colicky abdominal pain in elderly is likely what? Ruptured AAA until proven otherwise. Pain from nose to navel should get which test? EKG. 3 signs of cholecystitis are thickened gallbladder wall, pericholecystic fluid, and a sonographic Murphy sign. Test for suspected cholelithiasis cystitis. Ultrasound. Any pain in the right upper quadrant gets an ultrasound. Pancreatitis treatment. IV fluids, NPO, plus minus NG tube. Acute pancreatitis is considered if lipase reaches what level? 3 times of the upper normal level. Most common type of skin cancer, basal cell carcinoma. Most common presentation of eczema, scratching and pruritus. Most common type of basal cell carcinoma, nodular. Most common type of melanoma, superficial spreading. Most common type of melanoma in Asians and blacks, acral lentiginous. Most common type of glaucoma. Most common, open-angle glaucoma. Most common anxiety disorder is general anxiety disorder. Length of time needed for symptoms to be present to be diagnosed with the GAD, 6 months. Hypervigilance, intrusive thoughts, nightmares, and flashbacks should make you think of what? PTSD. Length of time needed for symptoms to be present to be diagnosed with PTSD, 1 month. Strep pharyngitis should always be treated for how long? Always treat for 10 days to prevent rheumatic fever. Strabismus should resolve by what age? 4 months. If not, they get an opto referral. Treatment for PTSD. SSRIs and therapy. Most common cause of PTSD in a woman, rape. Treatment of choice for strep pharyngitis, penicillin VK. When can patient with strep return to the school? After being on antibiotics for 24 hours. Who gets preoperative EKG? Patients over the age of 40. What's Beck's triad? JVD, decreased or muffled heart sounds, and decreased blood pressure. 3 clinical signs associated with pericardial tamponade. Levine sign is seen with what? Angina pectoris. Unstable angina versus NSTEMI. How to differentiate it? Unstable angina will have normal biomarkers, where NSTEMI will have elevated biomarkers. Cabbage indications. Left main coronary artery disease, symptomatic 3 vessel disease, left ventricular ejection fracture, less than 40. ACS is caused by acute plaque rupture, atherosclerosis. Snowstorm pattern on an ultrasound is what? hydatidiform mole. Presidentia of the uterus refers to complete prolapse of the uterus. Which hormone is dominant in the luteal phase of menstruation? Progesterone. The most common type of GYN malignancy? Endometrial cancer. Test of choice for uterine leiomyomas? Pelvic ultrasound. Most common cause of placenta abruption? Hypertension. What's placenta abruption? Premature separation of the placenta. What's placenta previa? Abnormally implantation of the placenta over the cervical os. Placenta previa versus abruption. Easiest way to tell them apart. Previa is painless. Which vaccine can help prevent epiglottitis? Hib. Think epiglottitis if the child presents with drooling, sitting in a sniffing tripod position, and leaning forward. Epiglottitis diagnostic test. Lateral neck x-ray showing the temperate sign. What are the 3 Ds of epiglottitis? Dysphagia, drooling, and distress. The worst risk factor for angina is, it's not asking what's the most common risk factor, it's asking what's the worst risk factor for angina. Diabetes is the worst. The most common risk factor is hypertension. Human bites to the hand, you should give them what medication? Augmentin or Doxy. Most common mental disorder in the United States? Social anxiety disorders, phobias. First line medication given for performance anxiety? Propranolol. This is a patient that's going to tell you they got to give a big speech, but they're afraid, they're nervous, so forth. Darkening of the colon secondary to the laxative abuse? Melanosis coli. Most common bug causing otitis media? Strep pneumo. Otitis media treatment if the patient has a penicillin allergy? Ceftriaxone or cefdinir. If amoxicillin fails, the next step in management of otitis media is Augmentin. Most common bug causing otitis externa? Pseudomonas. What is Charcot's triad? Fever, jaundice, and the right upper quadrant pain. Pheochromocytoma symptoms triad: palpitations, headache, and episodic diaphoresis. What's Virchow's node? Metastatic tumor. It's a gastric cancer to the left supraclavicular node. What is Boerhaave syndrome? Esophageal perforation. What is Budd-Chiari syndrome? Thrombosis of hepatic veins. SIRS criteria: temp greater than 38 or under 36, white blood count greater than 12 or under 4, heart rate greater than 90, and respiratory rate greater than 20. They should have infection, and if you have 2 out of these 4, you have sepsis. Lateral wall indicates which vessel? LCX. Inferior wall MI, which vessel? RCA. What's considered STEMI equivalent? Left bundle branch block. Triad of preeclampsia: hypertension, proteinuria, edema with the onset after the 20 weeks of gestation. And our last question: what is the treatment for Lyme disease? Doxy. For children under the 8 and a pregnant patient, treatment is amoxicillin. So thank you guys for watching this video. I hope you find these fast or equal questions helpful. Please hit that subscribe button, that notification bell, give it a thumbs up.